With that, Colby, I'll leave it to you. We're looking forward to your presentation.
Great. Thank you so much. I appreciate it. And thanks to Dee and Shane and everyone with the REMI staff for helping me out with this. I really appreciate their support, been tremendous support in this, so thank you. Wanted to talk to you today, really wanted to take you back to the infancy of when we went into this pandemic and looking at where we were and how we positioned ourselves to brace ourselves, as you can see in the title, for this impact on with COVID and the coronavirus on our regional economy. For us, it was definitely a stressful time. We didn't know what was going on, but we had so many things going on at the same time that was actually being canceled or shifted around, or we just didn't know what to do. I think, at the time we had the regionals of the March Madness that we were getting ready for, and all of a sudden, I think we all know what happened with that when they canceled basketball season in the middle of a game, not just at the conclusion of a game, but in the middle of an NBA game. So that put that on hold. Schools started shutting down. Students were being sent home. We had spring festivals that were being canceled. Just a lot of things were going on top of just the response from the local governments and state governments. Next slide. So just wanted to give you a little background to kind of set the scene for where we were back then in the February, March timeline of 2020, and to take a look at the first attempt at trying to prepare ourselves for what was going to happen in the months to come. Now, after that, we continued to build on this, but I thought it was pretty important to kind of show everyone what we were thinking about without any guideposts, without any real understanding and nothing to really pull from in order to guide this process. I think everyone was pretty much in a reactionary state at that moment. So for us, we were trying to look at what could we do, what did we need to do, and then where do we go from there. You can see here, the coronavirus was first confirmed in January, the first death in February, and then in March, it was branded as a pandemic. So in that time, the first week of March, we decided to put together a task force as well, just like the administration did, to try to look at all of the dynamics that were happening within our region, and to also look at those prevention measures that were being touted and how can we actually implement those at our level to counteract the spread of that virus. And then the federal government, they started to pull the fiscal and monetary lever. So of course we had to respond to that. And so it was important, and it was so vital that we had the REMI model, because we do consider Atlanta to be a response to national phenomenons more so than regional or state. So to look at what was happening at the national level and able to reflect that and calibrate the model appropriately to have that as a trickle down effect to what was happening in the state of Georgia and also our region was vital and critical to this process. So for us, when we started to look at what was happening from the federal and federal administration and at the national scale, the states started to respond and enact their protective measures and responses to.
Excuse me, sorry to interrupt, Colby.
Yeah.
Some folks are having problems seeing your slides.
Okay.
Let's try to share screen again, probably.
Well, I'm not sharing my screen. Actually, Dee is helping me with that since I can't share.
Dee, can you share the screen, Dee?
Yes, give me 1 second. I'll refresh it and update it.
Thank you, Dee.
Sorry about that, everyone. Can everyone see the background slide now?
I can. If people can comment in the questions panel, whether they can see Colby screens now. It's wonderful. It looks like we're having people that can see Colby screen, so it looks like you could keep on going, Colby.
You're on.
Okay, great.
Thank you, Colby.
Great, thanks, Dee. I appreciate it. So we're going to pick up some momentum here. So for us, it was vital that we had these in place, and we also had others putting out their GDP forecast for the year, and it went, it ranged from being flat to contracting about 1.5%. Next slide. So for us, again, we wanted to reflect that national slowdown in our model. We have the REMI Transite model, but we were leveraging the PI Plus side of the REMI model that we have in the house. It's a 70 sector model. So in its 21 regions, reflecting the 20 counties that we represent in the ARC as an MPO, plus the state of Georgia. So we wanted to reflect what was happening at the national level in the model. We also utilize Michigan's RSQE's economic outlook to calibrate the model and to take a look at the national landscape before actually developing controls at the state and regional level. Then we have some additional modifications, some calibration assumptions that we'll go through for the state and the region, and then analysis concludes in 2021 with some extrapolation out to 2022 for reference as we talk to our stakeholders and partners. Next slide. So for us, some of the assumptions that we built into the model to take in consideration was we aligned the case fatality rates and tried to make them consistent with CDC's 2009 flu pandemic rates, just to give some orientation to what we would expect with death rates as we updated the survival rates inside of the model. Then we included the latest federal stimulus response, which was really the phase 1 of the CARES Act, including the Families First Act that was included as well. And then we tried to take a look at it from a sector analysis, looking at industries that were being targeted and threatened, and then other industries that were actually getting positive feedback from what was happening with the pandemic. And then we looked at the trade restrictions, of course, that the administration implemented, and the demands for those imports were factored in from the US Census. Next slide. So here's the sectors that we brought in into the model and looked at for consideration. So those contracting industries: air, transit, scenic, performing arts, museums. All of these were really the crux of what was being impacted and affected by the pandemic, especially in the Atlanta region in the state. And then we had some industries that were pretty much having a positive impact. Not large, not huge, but they did have some small positive gains in response to the pandemic. So we wanted to take those in considerations as a balance to what was happening, and that was reflective in our region at the time. Next slide. So some other contributing factors when we were performing this analysis, we looked at the labor force participation, including those deaths, hospitalizations, and those preventive measures that were being taken, and also the business closures that started to happen at a much faster pace as we started to venture more and more into mid-March, toward the end of March and early April. Then the supply and demand, those critical inputs that were interrupting our supply side, and then the demand side that dropped in demand for those outputs that we were accustomed to in our region, which was the food services, restaurants, and conferences and spectator sports. So we looked at that. And then also the behavioral influence, the physical distancing, avoidance, the panic purchasing that was happening with the grocery stores, and then how do we reallocate the consumption since those dollars weren't being spent in their customary industries and arenas, but they were actually being reallocated somewhere else. Next slide. So, and you can just punch through these, D. So these are the things that were happening and that we were taking consideration, all the headlines that were flashing through as we were trying to deal with this pandemic and what would be the impact of it all. You can keep flipping through, D, to take into account as well the stock market and the crash of the stock market and what was going on with that. You can continue to click through, D. You can go ahead and keep clicking through to the next slide. So all of these things were going on, including job loss with, the UI claims that were coming through that were really just hemorrhaging our labor force and what to do next. So with that, we looked at what was going on with the policy side, and we understood, the feds were doing their part, which is reducing the Fed funds rate and really providing that liquidity that was necessary for banks to continue to help the small businesses and help the economy. Concentrate on the quantitative easing with that emphasis on recapturing the businesses in the businesses that were being lost and actually put on hold during the pandemic. Then there were some fiscal policies that were being leveraged. We talked about the relief packages, some stopgap resources to address that supply and demand shock, and then how do we counter those unemployment challenges with the influx of those relief dollars that were going directly to the households, and then buoying those vulnerable small businesses to keep operations afloat, and then looking at those threatened industries and how to mitigate the onset of a recession in that trough, anticipating the trough that was going to happen eventually. And then those behavioral implications, again, looking at the physical social distancing, the sanitation protocols that were now all of a sudden being implemented at businesses and also at the individual level, and then the non-essential travel when travel just came to a halt and impacted our tourism industry in that effect. Then we had the shelter in place, the work from home, teleworking, 100% teleworking for some, and then the encouraging of that by other private industries and corporations really trying to adjust to deal with the virtual workspace and flexible hours that were necessary to keep businesses afloat and to keep productivity to where it needed to be. And then we also had to observe those risk messaging, focusing on all the messaging that was focused on avoidance, staying away from each other, and not shaking hands and all the other things, and being mindful of your behavior at the time, which really put a damper on the economy as well, with only so many people being able to enter an establishment compared to it being open, 100% occupied. Next slide. So we took a look at some scenarios, and here you can see that we had 6. We decided to go with 3, and they were really pretty much effective containment if we were collaborating with other entities and stakeholders, how that would play out, and then an enduring fallout if nothing was done. If we were just to let the pandemic just run rampant, then how would that look? So you see here the severity of that, and then the vulnerability, which is, how did they put individuals, the vulnerability of individuals when it came to were we implementing those avoidance practices and modifying those behaviors and working remotely. You can see here in the low scenario, the low category, we weren't not taking that into consideration. So we're like, no, people are still going to work. People were still dining out, those things. And then as you can see in the other 2, we were saying, no, they started to implement those protocols, those safety protocols. Did we neutralize the virus at any point through these scenarios, and it was really no. Did we have any vaccinations, any therapeutics? So no, we didn't take those into consideration. And then the production cycle, you can see here we looked at, with the low, it was a delayed production cycle, but as you move on through getting more aggressive, then we went to full disruption of the production cycle. And then what do those outcomes look like? That was the best case scenario, pretty much a marginal. And then the worst case scenario. Next slide. And so here we started to say, okay, well, if this is going to happen, then we really need to start to really define what's the severity and what's happening here. And talking with other economists and other stakeholders, we started to really try to define what those cases look like. So the severity was really critical here, and looking at was a prolonged exposure. And then if it was a prolonged exposure, were we all on one accord with the public health experts? If we weren't, then we were going to have a severe case. And then the critical case was if there was just administrative roadblocks, like what we're witnessing now with the second relief package being really just at a standstill right now, and then with loose oversight and lack of implementation. Next slide. So here, again, we just wanted to look at the framework of it, the conditions, the outlay, and then how would we recover? So that class, you can see at the far end, would it be a quick recovery, a V-shaped recovery, or a U-shaped recovery? At the time, again, this is back in March, we weren't considering K-shaped, W-shaped recoveries or the swoosh or anything like that. So we were just trying to get our hands around what did we think, how do we think it would look as far as a recovery and rebound. Next slide. So really fast, this is just our case fertility rate or point estimate, looking at the CDCs and what they were looking at by age cohort. And you can see here in a vulnerable scenario compared to if it was a containment scenario, how it was impacted and what that looked like. So in a vulnerable scenario with people being more vulnerable to it, you can see that it was definitely more fatality. The rates were higher as far as fatality than they were if we contained the virus. Next slide. So lastly, we wanted to look at the timeline. So in the crux of all of this and what was going on, how long did we think this disruption would last? So with the moderate case, we thought it would just be focusing on Q2. Then with severe case, we said it would extend into Q2 and Q3. And then with the critical case, we said it will last pretty much 4 quarters into Q1 of 2021 with that U-shaped recovery. Next slide. So we looked at some industries, and you can see here, this is from the Oxford study, impact on hotel rooms. And we really just wanted to see how dramatic or how severe this pandemic really was. So we looked at the recession in 2001 from 9/11, and then we looked at the recession of the Great Recession, and then we looked at what we were facing with COVID-19. And you can see here, from 400,000 jobs lost to now we're looking at anywhere from 2.8 to 3.4 million jobs lost. And then you can see the occupancy rate with the hotel rooms. They were roughly half occupied through the previous two phenomenons and economic shocks, and now we're looking at 25% occupancy rate. Next slide. We also wanted to take a look at tourism in the travel industry. So we want to understand what was happening to actually calibrate the model. And you can see here some highlights of what was going on throughout the nation, Hawaii and the Northeast. But in particular, looking at Georgia, you can see a year-over-year net change from 2019 to 2020. And you can see by March 28, you can see that we were losing about $483 million from the previous year. And so it was just putting everything into perspective with what we were facing. Next slide. So we'll look at these really fast. This is what we're anticipating. Again, this is back in March. We were looking at in Q2 about a 30% contraction. These are seasonally adjusted, so this is for the quarter. This wasn't annually. And then you can see it by scenario, looking at the moderate, severe, and critical. So at moderate, we're looking at about a 12% contraction. With the severe, we were expecting in that scenario about 22 to 23%, and then in quarter two for critical, we're looking at about 30% contraction in GDP. Next slide. For Metro Atlanta, we follow suit. So we were expecting for the critical scenario about anywhere just north of 13%, around 13, 14% contraction in GRP. Next slide. Looking at state unemployment, wanted to factor that in to see, really what was the possibility of the number of jobs that we would lose, and that was hard to swallow for a lot of people in the room. So, we really had to talk about that and really take that and swallow that pill about losing, hundreds of thousands of jobs in a quarter. So that was really impactful. Next slide. And then we looked at the region, again, looking at about 250,000 jobs being lost in quarter two due to the pandemic. Next slide. And then the case fatality rate, we just wanted to kind of get an estimate on the amount of deaths that we could expect over that period of time. And you see at that time, we were looking at about 800 deaths throughout the state compared to where we are now. Next slide. In Metro Atlanta, same. We were looking at in the critical, almost 150 deaths by quarter two. And then you can see by quarter three of 2021 where we were estimating to be. Next slide. So for the US, we were looking at, in these cases where we stacked up as far as employment, GDP, and personal income. So you can see here in a critical scenario, loss of just over 27 million jobs with a contraction of 30.3% in GDP and about $1.5 billion income loss. Next slide. Same for the state of Georgia, looking at about 810,000 jobs lost, 16.3% contraction, and about $36 billion in income loss. Next slide. And then for our region, we were anticipating about 540,000 jobs lost, about 14% contraction in GRP, and about $28 billion lost in personal income. Next slide. So for us, what was next? Continued data collection, continue monitoring economic indicators and conditions, looking at some near real-term data to try to incorporate into our modeling efforts. Look at and assess the business restarts and when reopening operations would happen, recovering operations would happen, and how that would impact our region. And then, of course, where we are now, looking at the pandemic flare-ups and how do we classify them? Are we looking at first wave or second wave? So that's what we've been doing since March in updating our economic analysis as we move forward up into this point where we are today. So now that we're upon the election, that's going to have an impact on what's happening moving forward as well. So that's something else that we have to take in consideration as far as from the policy standpoint. Next slide. With that, any remarks, or I'll hang on for as long as I can for Q&A. My battery's running low. I apologize, but thank you.